So we're going to talk about neutering. The reason why we neuter is to obviously avoid unwanted pregnancies. There is a lot of dogs and cats that are needing homes, so if we can avoid the unwanted pregnancies and actually give a pet a home that needs to be, obviously this is better. Also, with regards to neutering, it's safeguarding your pet's health. So with females, this is known as spaying. With spaying, it prevents them having a season every kind of 6 months, so this stops the bleeding. It also means that you don't get any false pregnancies, and they can't get a pyometra, which is a life-threatening womb infection. They also stops them getting cancer in that area, because we do remove the ovaries and the uterus as well. With regards to males, it's known as castration. The reasons for doing this is it can kind of prevent unwanted behavioural problems. It can stop them wandering. A male dog can send a female dog in heat for quite a long distance, so it prevents this happening. It stops testicular tumours developing, because obviously there's no testicles there, and also it prevents diseases of the prostate. We normally do the procedures around 6 months of age, but we can leave it a little bit longer if you've got a large breed of dog. With regards to both the castration and the spaying, they are major operations and they are done under a full general anaesthetic. The patient will need to stay with us for the full day, but normally you drop them off in the morning and then they can go home later on the same day. We do recommend that we do pre-anaesthetic blood screening. It just ensures that the pet is fit and well before the general anaesthetic. With regards to the male's operation, it's quite a straightforward procedure, a little incision above the scrotum where we remove both testicles. And with regards to the females, it's a little bit more involved. The wound's a little bit bigger on her abdomen. We do recommend that all patients either go home with a buster collar or a medical pet shirt, just to prevent them getting to the wound and interfering. The stitches that we use in the wound are all dissolvable normally, so at the surface of the wound there's nothing to see, but we do advise that clients monitor it closely at home. We normally see the patients 2 days after and 10 days after the operation, just to ensure everything is healing as well as it should be, and they normally go home with a bottle of pain relief just to keep them nice and comfortable after the operation.